Glad that you could join us here today. Our guest today is Dr. Bhaskar Srivastava, and he's joining us today as Director of Medical Affairs and Dermatology at Janssen Pharmaceuticals. And he's going to discuss some abstracts that are being presented at the American Academy of Dermatology. Welcome, Doctor. How are you today?
Thanks, Neal. I'm great. How are you?
Great, great. A bit of background about yourself for our listeners, and then we'll jump right into this brand new development called Tremfya.
I can give you some background about myself. So I am a dermatologist and immunologist by training. I did my MD and PhD at University of Pennsylvania and my clinical training at Yale University. I finished up there in 2011 and stayed on faculty for a few years, was in practice for a few years after that, and then joined Janssen about 2 years ago, around the time that we were gearing up for the launch of Tremfya. And it's been an exciting ride.
Now, talk about this long-term drug, why it is so much better than what's already out there.
So the data speak to various strengths of Tremfya. The first point that comes out is that you see superiority to Humira at all tested secondary endpoints. And so I think this gives very valuable information to healthcare providers and patients regarding the superiority of Tremfya to Humira, which will be a very commonly used and well-known drug. So I think that is point one in comparison to what else is out there.
How many people are we talking about that were involved in the trials?
Yes, so the total number of Tremfya patients in VOYAGE 1, so if we're talking about the trials where we compared to Humira, the total number of patients, and I'm sort of going off the top of my head here, I could give the exact number, but it was around almost 330 in VOYAGE 1 and almost 500 in VOYAGE 2. So let's say we're talking about 800 plus patients on Tremfya, and then I think it was around 330 patients in Humira for VOYAGE 1, and I have to look at the VOYAGE 2 numbers exactly. So we're comparing over 800 Tremfya patients to several hundred Humira patients.
Is there any significant change into how Tremfya is administered as opposed to Humira or any other type drug for plaque psoriasis?
There are various drugs, both oral and injectable, that are FDA approved for even to moderate plaque psoriasis, and the range is from oral to intravenous to subcutaneous administration. Tremfya is administered subcutaneously at weeks. It's 100 milligrams, one injection at week 0, 4, and every 8 weeks thereafter.
It's basically a relief of symptoms that will occur, but not as frequently based on being injected every 8 weeks after weeks 2, 4, and 8?
So the injections are at weeks 0, 4, and then every 8 weeks thereafter, so 12, 20, 28, etc. I think in terms of relief from symptoms, patients have different degrees of response. Our primary endpoint was PASI 90, it was co-primary endpoints, PASI 90 or IGA 0/1. So PASI 90 is a 90% improvement in your psoriasis, and IGA 0/1 is clear or almost clear of psoriasis. And so 7 out of 10 to 8 out of 10 patients achieve that. 7 out of 10 for PASI 90, 8 out of 10 for, or more actually, for IGA 0/1, achieve those endpoints in the trials. So those patients would expect that those high degrees of clearance, and we also tracked the degree of improvement in patient-reported outcomes, right, which included signs and symptoms of psoriasis, and patients also excellent responses in those domains. Among those patients, there were patients whose skin was completely clear of psoriasis, and patients who achieved patient-reported outcome measures that were also showing no impact on the quality of life. Not necessarily all of those data are not necessarily in our label, but they are available in different abstracts at scientific conferences. So to sort of answer your question there, some patients can expect complete resolution of their psoriasis and their symptoms. And even our primary endpoint, many patients can expect 90% or clear resolution of their psoriasis.
Are there any limitations as to the availability of Tremfya?
So I can only really speak to the United States, and Janssen is committed to ensuring excellent access for Tremfya. And there are programs in place to help ensure that for patients.
Now, where can we go online and learn some more about Tremfya and about Janssen Pharmaceuticals?
you can go to tremfya.com.
All right. Well, thank you so much. It's been a pleasure. I hope you'll come back and talk with us in the future, okay?
Absolutely. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to the podcast on iTunes and be sure and check out our affiliates page at hpr.fm.